Hey, this is Brandon Steele with Chiro. I've got Brad Russell, a chiropractor down in Birmingham, Alabama, and we just did an interview, and I was left with one question that was unanswered, and I really wanted to ask you the question, so we're going to go ahead and do it right now, and that is, why do you market to medical doctors to begin with?
So again, there's a lot to talk about here, but I think I can answer this with wearing three different hats. So first is just the good doctor hat. Truth is, I believe this is just good healthcare. I think this is the way healthcare is going with the advent of ACOs and patient-centered medical homes, the communication of data, the sharing of data. And I think this demonstrates that chiropractors can play in that field, that we can provide additional information on patients, that we can share these patients and be able to communicate that data to them. Also, I think from a current standpoint, whenever I refer a patient to a neurosurgeon or I refer a patient to an orthopedic surgeon, I typically get a report back from them. And so I think we're looking like the other healthcare providers. We're looking similar to them, not different. It also, whenever I get that report back on a personal level, it makes me feel good. It gives me a little sense of recognition that they recognize that, I had referred the patient over there to them, and they were going to communicate back with me. And it lets me know that my patient's going to be well taken care of. And the truth is, I want the primary care physicians and other physicians we refer to us to feel the same way. So, taking off the good doctor hat, I'm going to put on my good businessman hat. I just can't think of a better marketing strategy that we could possibly have as chiropractors, to be able to get your name in front of a medical physician over and over and over and over again over the course of your practice career. It's so inexpensive to do. And the interesting thing about it is it's not really seen as marketing. It's seen as just good quality care. And there's so much, it's so subtle, but it's such a powerful tool. You can just about communicate anything you want with the physicians that you're interacting with. If you know that a specific physician has a concern about the stroke risk, in fact, we had this happen. We had an orthopedic surgeon tell one of our patients that he liked back manipulation, but he really didn't like neck manipulation because he thinks it can cause a stroke. And we were able to just write a very simple sentence into our report, and we included at the time it was a number of years ago, but we sent the Cassidy study along with the report to that doctor. I think we were effectively able to at least get him to start questioning why he was thinking that way. Studying the medical physicians and what they think about us, I think there's a lot of myths that they don't like about us. And it's a way for you to dispel a lot of those myths. For instance, chiropractors are a black hole. Once you send your patient to a chiropractor, once they start going, they never come back to you, and the chiropractor tries to take over their care, being the managing physician. This just demonstrates that we're not doing that. We have our niche, we have our role, we have our place here, and we're going to do a great job of it, but then we're going to refer them back to you and let you continue the management of these other conditions. I think some of our physicians here think that chiropractors are under the impression they can cure anything in the world. It goes back to some history in chiropractic, and I think this is a way to say no. At least for our clinic, we're a narrow scope. We're musculoskeletal care, and on the conservative side. And if we can't do it, and we can't always do it, then we're going to get the patient where they need to be or get them back to you and let you manage it. And again, just a great way to demonstrate effectiveness, using outcome assessments, showing the progress that we've made with patients. And so if I take off the good businessman hat, I think we can talk about an altruistic hat as well. I think this is a great way, if all chiropractors would do this, a great way to demonstrate, one, to medical physicians that patients are using chiropractors. And if they're adamantly opposed to it, they need to recognize that their patients are already seeing us anyway. And they don't want to, and this is a way to say, hey, look, we're not doing it under the table. We're not, we want you to know what we're doing here. And by showing good outcomes, by showing that we're doing a good job for people, that it's safe, that patients are happy, I think we can, in some ways, change the medical community's mind about chiropractic at this point.
I love that.
Yeah.
I think that, that's why, I really wanted to ask that question to you, because I feel like we have the same mindset. And I see so many doctors when they come out and they want to know how to market themselves. And I think some people try to go on to a polarizing view. They want to take out big ads and convince the public of something different to polarize or to separate themselves from everybody else. But like you said in the last interview, there's someone treating the other 95% of people in pain, and it's not chiropractors. These people are already seeking care. Let's be a part of that. And it doesn't mean that we have to be a medical doctor. It doesn't mean that we have to convert in what we think is necessary with manipulation. It just means that we're a part of that system, and we're a narrow scope part of that system. But when we are part of that system, we're a very effective, cost-efficient, member of that team. So I really appreciate that. I like the three-hat mentality. I'm going to talk about that with some doctors next time. And I think that you're right. There is an altruistic, piece of that. There is a business piece of that. And there's a personal piece of that. But the end person who benefits that is the patient. The patient's going to benefit from all those things. So it's not finding ways to get more patients that keep them longer. It's just finding more patients to treat and treat well, and hopefully have that good outcome. So yeah, I really like that. So once again, Dr. Russell, it's always a pleasure talking to you. I can't wait to get down to Alabama. I unfortunately had a seminar. I was going to be there in Birmingham for your state association, and I did get canceled. That was the one I think in June or July. And so hopefully I'll be able to be invited back down, and we can talk more about the medical marketing and more importantly, just where we see the profession going.
Brandon, I will confidently call my executive director here in a minute, make sure that we get you back down, because I'd love to have you.
I appreciate that. Well, thanks again. Have a great weekend, and I appreciate you doing this interview with me.
Thank you, sir. You too.
All right, thanks.